Hello, everyone. Good evening. I am Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about a very important topic, which is about our skin health with focus on urticaria hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch intensely. It may be due to chemicals in certain food, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venerology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of the patients are in the age group of 20 to 40 years old. Incident is higher in older age group. Urticaria is classified as acute and chronic, but most important part is not to ignore, and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for the diagnosis, and the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Janani Arunkumar is MBBS, MD, DVL dermatologist. She has years of experience in this field, and her skill and compassion has made tremendous difference in patients' life. A warm welcome to you, doctor. It's a pleasure to host you today, and we are going to discuss about a very important topic as mentioned, which is urticaria. So let's know in your language what is urticaria. Right. I believe we lost our connection with doctor, so we are trying to get her connected. And all the people who has already connected with us, please stay online because we are going to discuss about urticaria. We are in discussion with Dr. Janani Arunkumar, and we are trying to get her connected. We are going to target a lot of topics today about the do's and don'ts we need to take care of if we are suffering from urticaria. And as we already know that most of the people might have encountered this condition, and maybe we are conscious about it, maybe we are not conscious about it, but we might have encountered this condition at some point in our life. So yes, today we will be able to identify the condition, and we will be able to identify uh, how it looks like and what it would be like if uh, someone is suffering from the condition. So we'll request everyone to please stay connected with us. We are trying to get doctor connected. Yes, she is right here. Doctor, moving back to the question, uh, can you please elaborate for our viewers what is urticaria? Right. Am I audible, doctor? Can you hear me?
Yes, ma'am. Yes, ma'am. I can hear now. Yes, ma'am.
Yes. So we will continue with the first question, doctor, which is what is urticaria?
So, urticaria is actually it is basically an allergic response. Okay, immediate allergic response which is happening in our skin due to nasal activation. Okay, so this is one of the commonest disorder which uh, everyone can see in their all dermatologists can see in their OPDs. So, so it is basically characterized by presence of multiple wheals, which is associated with itching. Sometimes can also be associated with angioedema that we call as swelling of lips as well as swelling below the eyes. So this is what urticaria commonly present to a dermatologist, and we see it and we diagnose it and treat it.
Right. Moving ahead, doctor, the next question is what can be the main cause behind it?
So basically, urticaria, as I said, it can be like if you divide like, based on the acute as well as the chronic, the causes is different. Okay, so commonest cause which we see is
I'm sorry for the network glitch. Absolutely sorry for the network glitch. There has been a slight network interruption today. We are again trying to get connected with Dr. Janani, and we'll request you all to please stay connected with us. Well, all the viewers who are watching us right now, if you have any questions regarding the condition or the topic today, which we are going to discuss, you can write down your questions in our chat box and send it to us, and we'll make sure that we answer all your questions today.
Hello, can you hear me? Hello.
Yes, yes, we can hear you, doctor.
Yes. So, commonest causes mostly is due to allergy. So that due to foods, okay, like especially the patient can tell like I'm allergic to seafoods, especially like fish as well as prawn, and some patients can also give history of like they are taken outside foods. Okay, so that can be a second most common cause. And thirdly, urticaria followed by infectious cause like bacterial infections, mainly your streptococcus pyogenes. It is causing your fever as well as your sore throat. Then followed by your viral infections. Then these are the commonest acute causes. So if you go for the chronic causes, so it can be due to urinary tract infections and intestinal infestations. Okay, due to angiosperma as well as other parasitic infestations. Then sometimes even your dental infections. Okay, so that can also cause your chronic causes. And so identifying, taking the proper history and identifying the cause and treating it is very important in the management of bacteria.
Right. Well, you have mentioned the biggest challenge, which is identifying the condition. Most of us, we might have seen the condition occurring, but we could not identify it. So, how does one identify urticaria? How does the initial stage look like?
Actually, if we speaking the identification part, so like first, I would always go with proper history, then followed by examination. Okay. So first, I will rule out all the causes. Like I will start taking history from what are the just I'll rule out the acute causes. So as I have discussed previously, like if there is any history of the patient has taken any outside food, or there is the patient has been allergic to any of the seafoods, or if he is having any form of infectious cause. Okay, actually infectious causes like more common among the children. Okay, upper respiratory tract infection is more common in children than the adults. So all these acute causes I just ask. Then I just rule out the chronic causes. Okay, like if they have any infestation, or they have any dental infections, or if they are if it is has been associated with any other form of autoimmune disease, because most of the chronic urticaria has been associated with autoimmune thyroid disease, and nowadays they are telling like even your H. pylori bacterial infections in the stomach, okay, that is also be commonly associated with chronic urticaria. So like this, I rule up all the causes first for the acute urticaria. Then I'll just go for the examination. So history taking is very very important. Then I can go with examination. So in the examination, I just see the findings. Okay. So I just see if there is any presence of wheels. Okay. So wheels is the most common presentation of urticaria. Okay. Then I just look for any features of angioedema. Okay. Then most important thing is in urticaria, you should ask one important question is like how long the wheels has been started, and now how long it persists, and when it is disappearing. So this single question itself will give you a main clue in the diagnosis of urticaria. Okay. So most of the wheels they will appear and they will disappear spontaneously. Okay. After the patient is supposed taking either Advil or Vista, it will disappear, or sometimes it will disappear. Most of the cases spontaneously. Okay. So that is the one single clue which is the diagnosis. Then after history and examination, so main thing which I will do regularly is I go ahead with dermographism. Okay, so dermographism is like blunt soaking of the skin with the help of the blunt objects. Okay, so that will produce the erythematous response. Okay, so this is actually based on your triple response of Lewis. Okay, so that actually gives a diagnosis of that we commonly called as simple in dermographism itself. Again, we have multiple types. So based on this, again, we can diagnose urticaria. So these are some of the clinical things so which can do. Suppose if other causes are there, suppose if the patient is telling like I have urine infection, then we can do test for that. Like we can do ahead with urine routine or urine culture. Then suppose if the patient is having underlying thyroid disease, or suppose if he is so then we can go ahead with hemoglobin or thyroid profile. Okay, so based on the symptoms as well as based on the underlying cause, then we'll go ahead with the diagnostic procedures. Okay, and suppose skin biopsy is actually very rarely needed in urticaria because suppose if the wheals are persisting for more than 24 to 48 hours, okay, then we call as arterial vasculitis. Okay, so in that case, okay, so certain diseases can mimic like arterial. Okay, so in that case, we can do the skin biopsy to confirm our findings. Okay, so these are all the basic things. First, to start with the history, then you have to go with physical examination. Then, what are the basic tests we'll do? Then, finally, about the diagnostic test. So this involves, I think I have given some outline of approach in the diagnosis of urticaria. So further, if you go deeper based upon the cause, I think we can do the specific investigations based on that.
Right. Doctor, moving ahead, the next question for you would be, uh, what are the potential complications of urticaria if somebody is not treating it? Because when we're talking about urticaria, we know that it it itself heals. It self cures after a certain period of time. It can last for few minutes or few hours, but gradually it heals by itself. And mostly people has a tendency, whatever things it heals by itself, they don't feel like treating it. So, what if somebody is not treating the condition? What can be the worst case scenario?
So actually, Urticaria is like one of the what we tell, not so common, but it's one of the emergency conditions, okay, which in dermatology which we can tell because if you are not treating, it can lead to emergency, okay. So basically, it is like what we call as it is like type 1 hypersensitivity reaction, okay, that is like basically it is mast cell mediated disorder, okay. So these mast cells, once they are activated, okay, whatever causes I have said, okay, because of all those stimuli, okay, so mast cells is getting activated, and these mast cells, it will release a mediator which we call as histamine. Okay, and this histamine is responsible for causing your immediate that we call as type 1 hypersensitivity reaction. Okay, so if you are not treating urticaria at this early stage, so it can go for complications, which is because of these type 1 hypersensitivity reaction, that is called as angioedema. So angioedema is one of the important complications, most important and most common complication also we can tell. So that is involving your it is involving your larynx. Okay, so that can cause laryngeal edema. So at the next minute, the patient can present with breathing difficulties. Okay, so they cannot be able to breathe and they can go for bronchospasm. And if you are not treating at that stage, with you have to give immediately adrenaline. Okay, injection adrenaline we have to give immediately. So if you are not giving at that stage, patient can die. Okay, in front of our eyes. So that much severe is type 1 hypersensitivity reaction. Okay, it is also called as immediate form of hypersensitivity reaction. So this is the commonest complication. Then other complications is suppose it can go for rarely like urticarial vasculitis. Okay, so urticarial vasculitis is actually a rare thing, but we can suspect that if the, as I said earlier, if the wheals is not resolving at an early stage and if it is persisting for more than 48 hours, okay, then the patient can present like arterial vasculitis. So we have to always do a biopsy. Okay, if the patient is wrestling with arterial vasculitis, so next step is we need to do a skin biopsy to confirm it. Okay, so that is one thing. Even arterial vasculitis, again we have several causes. Like we have hypercomplementing, based upon the complements it is involving. You can go for hypercomplementing type is also there. Arterial vasculitis is also there. Okay, so this is again one of the things. And third one, they said is about your other autoimmune acute areas. Okay, so that is also can happen. Okay, so these are all the autoimmune disease, especially it is associated with autoimmune thyroid disease. Okay, so that can also be a part that is called as autoimmune urticarias. Okay, so these are all the few things which we should always remember. And commonest thing is the first one, the hyposensitivity reaction. Okay, so to prevent that, we should treat urticaria at an early stage. That is very very important.
Right. Doctor, because we know that the causes are unknown when we are talking about urticaria, it can be anything.
Yes,
Let's talk about the basic things from which people are suffering. Sun rays, we
okay.
have heard that people also suffer from sun rays, like urticaria
Yes,
can be caused from sun rays or rainwater. I have
yes,
seen personally in my life that people
yes.
get rashes if they are exposed to rainwater, or
Mm.
water is also another cause. So how do people deal when the causes are such basic? What can be the solution to it?
So as you said, so people who are exposed to this sunlight, okay, so they are also developing this urticaria, so which we call this entity as solar urticaria. Okay, so that means they will be exposed to the UV light or sunlight. Immediately they will develop this urticarial type of ashes that we call as beads. Okay, so that we call as solar urticaria. Okay, solar urticaria, I think I have seen only few cases. It's not common presentation. But once if the patient comes to a clinic, so we should be able to manage it. Like should avoid exposure, frequent exposure to sunlight. Then we can use some form of sunscreens. If it is more extensive and if it is more severe, then we can start off with oral steroids in that case. And as you said, second type is you have talked about the water exposure. Okay, so some patients actually after exposure to water, okay, so they will develop these type of urticarial rashes and leaves. So that we call as aquagenic type of urticaria. Okay, so that patient also we can avoid. Some patients know they will tell specifically like if I expose to hot water. So I will develop this wheels. So some patients will tell, very few cases they will tell, I've been exposed to cold water. So that time I have more chance of developing this. So that entity we call as cold urticaria. Okay. So depending upon the cause, okay, so the management as well as advice varies. So depending upon the type of urticarias. Okay. So these types and all usually come under inducible active area.
Right. Doctor, can stress also somehow trigger urticaria?
Not hearing properly. What you're asking.
Can stress also somehow trigger urticaria?
Somewhat triggers for active area. Okay,
Stress.
so stress you are asking, huh?
Yes, yes, yes.
Yes. Okay, okay. Stress is yes. Of course, stress can also trigger active area. Okay, because I think I don't know whether they have done a study recently on that, but previously I thought they said like this stress and even your menstrual cycle. Okay, so this also can trigger urticaria, especially in the menstruation phase. Also, if you see like in the pre-menstrual time, okay, this urticaria is more commonly it's aggravated. So these are not because of the hormonal changes. Okay, so they said there is due to some imbalance in estrogen as well as the progesterone ratios. Okay, so that is further provoking the arterial lesions here.
Right. Can the condition also be transferred genetically? Is it possible?
Don't think like sometimes this family history is there, but as such, I don't see any cases so far. Like it is not that much common. Like family history, it's like a thing. But I think the atopic history. Okay, some persons know they have like mother or father is having this atopic history. It's like having tonsillitis, not sometimes it's dust allergy. So all this patients, if the father or mother is having, they have this issue of atopy. In that case, it can trigger, but not that much commonly. Okay. So when I discuss the commonest causes, like what are the acute causes, what are the chronic causes. So compared to that, this familial history, I think it's not that much common, and it is very less also.
Uh, So what if a lady during her pregnancy is suffering from urticaria? Can it be possible that the child also carries the same condition?
Actually, they are telling like during pregnancy there is this arterial type of lesions can also occur, but that we call as this atopic eruption and this polymorphic eruption of pregnancy all can present like with this, and this polymorphic eruption, no, that is more common that we call as puff. Okay, puff is like polymorphic arterial papules and plaques. Okay, that lesions will look like that similarly, but it is like pustules more common in the I think first and second trimester, but most of the studies are telling so after delivery that postpartum period and also the when it is reducing, that is severity is reducing immediately after the delivery. That is the patient is nearing the postpartum time. Okay, so that case this arterial lesions are usually resolving after the postpartum period. Okay. But it is more common during either it can be aggravated in the second trimester or it can be in the third trimester. But immediately after delivery or in the postpartum period, the lesions are mostly like it is resolving. Okay. And if a pregnant woman develops urticaria, we need to treat. Okay. So again, here the treatment options is different for each trimester. Okay. First, suppose if the patient is there in first trimester. Okay, so here you can give drug of choice chlorpheniramine malate. Okay, and suppose if she is in second trimester or third trimester, there the drug of choice is either you can go ahead with cetirizine or you can go ahead with loratadine. Okay, so depending upon the trimester, we have to treat the urticaria. Okay.
Right. Doctor, food is one of the biggest trigger when we are talking about urticaria. So, what if somebody is, struggling from food habits, or they are not able to identify that which food is actually causing the condition? What can be the best possible solution for them?
Actually, when we talk about vegetarian, food is one of the main trigger, okay, which I can tell. And already we have discussed what are the foods which is more commonly causing this. Okay, so if we have to ask the history again, okay, to the patient clearly, like what are the foods okay, which they are taking is more commonly causing this. Okay, most of the people, okay, they will know from the you can identify from the history itself. Like some will tell like madam, from my childhood, if I ate seafoods, I'm getting this more commonly. Okay. Whereas some people will tell, madam, yesterday I've taken outside food. After that, I developed. So we can identify easily from the thing. Okay. Whereas, as you said, some people may not know like what food they have taken. So it is responsible for this. Okay. So food, I can give a big list. Okay. So first one is I'm discussing about the common foods. Okay. So first is about the seafoods. As we discuss all kind of seafoods, okay, especially your fish as well as your prawns, then this is common thing. And apart from this, even lobsters, okay, this shellfish, okay, that is also responsible they are telling. Then next is about next list is about the egg, okay, so egg, and even your dairy products, okay, so that is responsible for triggering. Then next comes your example, mm, date nuts. Okay, so all kind of nuts that can cause. Then I can go with even your vegetarian food items. Okay, brinjal is most common, and some are telling this tomatoes as well as this spinach. Okay, spinach group of vegetables. Okay, so that is also causing this or aggravating this arterial type of lesion they are telling. And many are there. The list is very big. Okay, some it's like spicy foods, preserved foods, okay, tinned food items, more oily foods, okay. Then, as I said, seafoods, all these things, okay, the list is very big. And so nowadays, this what is it called? Food additives, okay, they are adding this coloring agent. So I want to stress that, especially if you are taking this outside food, okay. So this coloring agent is benzoyl toluene, I think this reagent. So that is causing this most of this arterial. There are some food items, no, so, especially even if you take this alcoholic people, okay, they are also more prone to develop this epithelium. In alcohol, again, we have this red wine as well as white wine. Okay, I think red wine is having this one compound called sulfite. Okay, that is actually responsible, and even the white wine also causes this. Okay, so again, alcohol is also one of the important factors. Okay, and all this thing and can cause this. Even carbohydrate rich foods, they are telling this butter, actually fat, oily foods in the butter is actually good, but butter substitutes it's actually more prone to cause this disease. They are telling. So again, we have to ask a patient in the depth detail, and then we have to find out the trigger, and we have to advise the patient. Okay, so all this list. Okay, so what I do is, whatever patient comes to my clinic, I just ask all the put the detail, and then I will write and I will write a big avoid list of all those things to avoid this, and then to take the drugs. So to avoid this for some period of time, okay, till they will feel symptomatically better. And most of the thing I just ask them to avoid completely, okay, till they are recovering, because if on and off they are developing the disease, that is also again difficult to treat.
Right. Doctor, infection, you said urticaria can also be caused from infection initially in today's life. You have mentioned that. Can COVID be one of the reason for it?
Yes, actually they have done a study, not now, like the COVID time period. Actually, I'm telling about the 2020 and 2021, at that time when the COVID is peak. Okay. They have done a study, and that study they have mentioned like cutaneous manifestations of COVID infections. Okay, so in that, one of the features they have mentioned is arterial type of lesions. So even the COVID-19 virus, okay, so that can produce either this arterial type of lesions or arterial vasculitic type of lesions. Also, they have said. I have read in one article, but a long term I remember only this. Points. Okay, so COVID-19 virus can also cause this arterial type of lesions. Okay, as we know, like I have said in the beginning, viral infection is one of the causes for your acute urticaria. Okay, so in that list we can include the COVID also, because this can also be a marker. COVID-19 is also a marker of urticaria.
Right. Doctor, because we are talking about a condition which occurs in the skin mostly, and we get very much tensed when it's about the skin, thinking that it can spread from one, if it can spread from one person to another. So, is urticaria contagious?
No, no, it's definitely not conditions. So 100 percentage, it is not a infectious disease. It is like, as I said, the if you understand the pathogenesis is very easy. Okay, so it is not infectious disease, 100 percentage, and it will not spread from one person to other person. Okay, that is the one thing. And second thing is, if you see the pathogenesis of urticaria, okay, this is you see in our body we have a cell which we call as the mast cells. Okay, So these mast cells, okay, they are getting stimulated. Okay, so whenever it is our body is exposed to certain form of stimuli. Okay, especially it can be either allergic stimuli or it can be a what is it? Non-allergic stimuli, anything. So allergic stimuli, as you know, we have discussed like food allergy. Okay, so all these things. Then next one is suppose if you go with the infections. Okay, there is a big list is there like viral infections, bacterial infections, parasitic infections. Okay, so all those things. And you know, even your chronic urticaria, if you take, you have the dental infections, urinary tract infections, then lower abdomen infection, parasitic infestations. Okay, so all these routines. So and sometimes you talk about I just to stress about this autoimmune thing. Okay, autoimmune urticaria has been associated with your autoimmune disease, like autoimmune thyroid disease. Okay, so all of them. Okay, so together, so they will causes this stimuli. Okay, if the person is having exposed to any of these stimuli, okay, so then the mast cells, okay, so the mast cells will get activated, okay, and there is some mechanism like the mast cells will have this FCIG, okay, so this IgE antibody, okay, so that is undergoing this cross-linking, okay, and in the mast cells you have this toll-like receptors, okay, so all these things will go, both this IgE antibody go and bind with the toll-like receptors of the mast cells, so both this IgE antibody and the mast cells, okay, comes binded, so these mast cells, no, it will get activated and it will cause it is undergoing degranulation. So actually the mast cells, no, it will have inside, if you see the anatomy, you can see the multiple vacuoles, okay, that we call as granules. Okay, granules setting. So that granules, each of them, no, they will contain the histamine. Okay, so once we expose to all the stimuli, okay, so these mast cells, no, they will undergo a process which we call as mast cell degranulation. Okay, so once this degranulation is happening, so it will release, these granules will break. Okay, and then it will release the mediator which we call as histamine. Okay, and this histamine, so it is once it is released, okay, so it will mainly act by, I think we have many receptors, okay, for the histamine drug. We have H1, H2, H3 and H4, but in skin we have H1 as well as your H2 is predominantly in the GAT. Okay, so here H1 is the main thing which all our drugs will act. Okay, so it is acting to that, and then it is causing the wheels. Okay, so we know that triple response of wheels. Okay, so initially there will be vasodilatation followed by edema, followed by this red wheel and flare will be there. Flare response will be there. So all those things will be happening. So once after this degranulation process. So this is how the pathogenesis of urticaria is involved. Okay, so it is not a infectious disease. Basically, everything is happening is full and full of like what we call allergic response. That is either it can be due to immunological or non-immunological mechanism also. Okay, but it is not involved with any of the infections. The pathogenesis is not related to any of the infections. It is full of like this, and most of the bacteria is, you know, this acute type is basically type 1 hypersensitivity mediated reaction. Okay, so definitely it is the pathogenesis itself is like this. Okay, so it is not the it is not, actually it is not contagious, and it is also not transmittable to other persons. Okay, so we can advise to patients also like as not contagious, so we can tell the others also. So if one is affected with urticaria, can inform to other house members also like it is not contagious and they do not worry about that.
Right. Uh, and with that, doctor, let's talk about the last topic which we are talking about
Okay.
today. Um, uh, uh, Doctor, what are the treatment options which are currently available? And tell us how long does it normally takes to treat the condition, and what is the rate of reoccurrence in the condition as well?
Yes. Actually, just for answer these questions, the treatment is actually depends upon the types. Okay, so like if we talk about acute urticaria, that there the treatment is different. If we talk about chronic type, so actually acute is which we call is the duration of the lesion persisting for less than 6 weeks. Okay, so that we call as acute urticaria. And the chronic is if it is persisting for more than 6 weeks. Okay, then we call as chronic type. Okay, so acute is mostly like at the sudden onset. Okay, so that time we have to be very conscious because if we have to treat it, we have to treat that very carefully. If we are not treating at that stage, we have discussed like the patient can go for complications. It's like there's angioedema, laryngeal edema, they can go for bronchospasm and all those things is there because of hypernitrogen. So treating the acute urticaria is very important. So what I'm suggesting is first we have to if it is acute onset, the patient is coming to us with very much itching and very much they are not able to tolerate the itching and the heels are more extensive. This the angioedema is there. Okay, so we have to give with the angioedema is there means it's better to give injection adrenaline. Without angioedema also we can start with avil as well as dexans. Okay, so chlorpheniramine maleate we have to give immediately. Usually give 2 cc IM start dose as well as dexa is usually control the inflammation. It's anti-inflammatory. So dexamethasone also we can give IM 2 cc as a start dose immediately. Okay, so this is the first step which we will I will like patient is coming to us with urticaria. Okay. Then once the itching as well as the wheals is settling, then we can go ahead with the topical soothing agents. Okay. So usually they are telling like calamine based lotions or menthol based lotions. Okay, that is very useful in the treatment of urticaria. So I usually prefer to give callus of okay, that calamine based lotions. Okay, because calamine is usually a soothing agent. So if you use in the rashes like condition means it is highly helpful. Okay, so I usually give calamine lotion daily, morning once and night for a period of 2 weeks. So after bath, the patient has to apply the lotion. Okay, all over the body, especially wherever the lesions are there, they can apply more. Okay, so that is for a period of 2 weeks I can give. Then I can start off with the antihistamines. Okay, so again, antihistamine choice is different. Okay, so for all we cannot give one antihistamine. It depends on the type, it depends on the patient, and it depends on the duration, whether acute or chronic. Okay, so choosing antihistamine is actually again very important. Okay, so first of all, suppose if the patient is we have to decide whether we have to give H1 antihistamine, this H1 antihistamine. We have two generations, first generation as well as second generation. Okay, first generation usually is like more sedative. Okay, and the second generation is less sedative. Okay, so depending upon the severity, depending upon the itching. Okay, so depending upon the types. Okay, so I usually prefer to give the antihistamines. Okay, suppose if the patient is coming with acute urticaria. Okay, so I think I can if there is no contraindication and the itching is more, I prefer to give cetirizine. Okay, suppose if the patient is coming with if it is not responding to it, then I can go ahead with dexloratadine. Okay, and even after the patient is not responding, means I can go with dexloratadine with combined montelukast, which is called as acid. Okay, so depending upon that, okay, we can choose the antihistamines. Okay, and suppose if the patient is a worker who's been working or he's a driver by occupation, then it is difficult to give the sedative type of antihistamines. So in that case, we can prefer to give non-sedative type of antihistamines. Okay, like your the desloratadine or loratadine. Okay, so all those things I used to prefer to give. Okay, then even it's good to give levocetirizine also. Okay, in that case, levocetirizine also can give. Especially I prefer to give levocetirizine in children. Okay, and compared to others, and depends upon the occupation also. Choose the antihistamine is very important. Then based upon the side effects, okay, suppose if patient is allergic to one drug also, we cannot give that drug specifically. So in that case, we have to choose the other type of antihistamines. Okay, and especially if you talk in pregnancy and lactation, again choosing the antihistamine is very important. Suppose if you are talking about a pregnant woman, suppose if she is in the first trimester, okay, so it is I would prefer to give chlorpheniramine IS. If you beyond the first trimester, if she is in second and third, then I can give loratadine or cetirizine. Okay, suppose if it is a case of lactating, it's best to give loratadine or desloratadine. Okay, so this ideally best to give loratadine first. If not there, then you can go with desloratadine. Okay, so it depends upon the patient preference, type of patient, then type of particular, it is acute or chronic. Okay, so suppose the bleaching is more, it is not controlled with other things, then I can go with hydroxyzine. Okay, actually they are telling 25 milligram of hydroxyzine is equivalent to your 10 mg of cetirizine. Okay, so that equivalent dose also we can give in the treatment of urticaria. Okay, next is if we go with the chronic urticaria. Okay, that is urticaria is not at all responding on and off, it is coming. Okay, then we have to do the definitely we need to do the blood test first, blood investigation. Then we have to find out the cause. Okay, always go with hemoglobin or I go with thyroid. Okay, so I just find out what is the cause. Then sometimes one patient also I have seen last week. Okay, so they came with complaints of the urinary infection. Okay, so they are having this lower abdomen pain, then burning induration is there. Typically, HC is there, and the patient is having this chronic urticaria for a period of 1 year. These lesions are there on and off. So then I have done this urine routine, then urine culture. Then I found out there is some urine infection is there. Then I treated urine culture. Based on that, I started the antibiotics. Then the patient has been responded well. Okay, after taking the urine infection, these urticaria lesions came down. So they are so happy also. So like that, we have to identify the cause. Okay, then we have to treat. In case of chronic urticaria, this is very important. Especially if you see the chronic urticaria, this parasitic infestation I talked before itself. So that is your bowel infestations. Okay. So I usually give this ivermectin and sometimes ivermectin with albendazole as a start dose also. Okay. Because chronic urticaria on and off it is coming means, so it is better to treat this combined drugs. Okay. And some patients I think they are responding better to this. If you combine along with the antihistamines, if you give ivermectin or albendazole, that's a better response is also there. Okay. Then third is about the chronic urticaria. Always we have to rule out this H. pylori infection as well as we have to treat it, and your autoimmune urticaria mainly is one of the causes for the chronic urticaria. So you have to also think about this autoimmune thyroid disease. Okay, so you have to identify that and you have to treat that also. And I usually prefer to give Blastin. Okay, Blastin. So it is very good mechanism of action is there. Okay, to give usually give in 20 mg. Okay, so the action is good. Okay, some patients will respond to 20 mg itself. They are not responding. I will give us 40 mg. Okay, depending upon the response, you can increase the dose. Okay, and now it's always better to increase the antihistamines. Okay, oral antihistamines can increase to the fourfold rise. Okay, if there is no response in case of your chronic urticaria. Okay, that is admitting guidelines. They are telling if there is no response, even you can increase the antihistamine dose to the fourfold level. Okay, so all these things we have to see. We are treating this the chronic urticaria. Okay, so I think Montelukast is of direct desloratadine is actually one of the best combinations which I usually give to my patients, and the response is actually very good. They give this desloratadine with Montelukast BD twice a day for a period of 2 weeks. The response is very nice and it is actually very good. My experience.
Right. Well, thank you so much, Doctor. We had a wonderful session today. That was our time, and we had so much to learn from you today. We would like to thank you once again for your valuable time. It was
Thank
a
you. Thank
very,
you.
very informative session for our viewers today, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they now know what to do. Instead of self medication, it's always better to approach a nearby dermatologist. It was
Yes,
great to
yes.
hear from you, doctor, and we look forward to many more such session in coming time. Also, thank you, viewers, for your excellent participation in today's session. And to get latest update on how to keep your skin healthy, do like and follow our Facebook page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and
Thank
stay
you.
healthy.
Thank you. Thank you so much.